You can place that patient in room 542. The room is ready, and I'll let the receiving nurse know that the ED will be calling a report. Hi, Pam. Deborah's getting a patient in room 542, Mrs. Smith. The ED should be calling soon for the handoff. Oh, thank you.
Free West, this is Debbie. How can I help you?
Hi, Deborah. I've assigned a new admit to you. You'll be getting Mrs. Smith in room 542 from the emergency department. She's 65 years old and admitted with a diagnosis of pneumonia. The ED will be calling for the handoff.
Thanks. I'll take a look at the ED encounter summary and get ready. Looks like the patient's being admitted with pneumonia. Vital signs look stable. Blood pressure's a little high, but she has a history of hypertension. She's received an antibiotic already, but there's another one that has not been given. I'll have to ask about that. Thank you for calling SSM. This is Debbie. How can I help you?
Hello, this is Katie from the ED. I'm calling to hand off care of Miss Smith, coming to you in room 536. Are you in a place where you can participate in handoff at this time?
Yes, I'm actually at the computer now. Let me pull up the ED encounter transfer summary report in Epic so we can view it together.
No. Thank you. Okay, bye-bye. This is the Italy. Yeah.
Okay, I'm ready.
Okay. Miss Smith is a very nice 79-year-old female. She's alert and oriented ×3, and her husband is at bedside. She came in tonight from home with complaints of a cough for the last week, and tonight with an increased shortness of breath. She's being admitted with a diagnosis of pneumonia. She has a past medical history of high blood pressure, and she has no allergies. Her initial vital signs when she came in were 179/84, a pulse of 106, respirations of 24, with an O2 sat of 94%. We placed her on 2 liters nasal cannula. Her vital signs have remained stable and in that range since her arrival. Her last set was about 10 minutes ago, and it was 172/82, a pulse of 108, respirations 24, and an O2 sat of 96% on the 2 liters. She has an IV of normal saline at to keep open, going through a 20 in her right AC. Labs were drawn and blood cultures were sent. Her only abnormal lab was her white blood cell count at 16.3. Her lung sounds were decreased in the right lower lobe. She has a wet, non-productive cough. We've started ceftriaxone 1 gram, but she does still need her Zithromax 500 milligrams when she comes up. Do you have any questions for me?
Yes, I do. Do you have the zithromycin, or do I need to get that from pharmacy?
We do have it down here in the ED, and I'll send it up with her. Have I given you enough information to safely assume care of the patient?
Yes, I don't have any other questions.
Okay, my ASCON number is 1234. I'll be here until 19:30, and please feel free to call me if you have any questions. If you wouldn't mind preparing the room for a stretcher, she'll need an IV pump, so I can bring mine back with me. The patient will be leaving the ED in about 10 minutes unless something unforeseen happens, at which time I'll call you and let you know.
Sounds good. See you in a few minutes.
Okay, thank you.